Hi, this is Brian Kim. I'm going to share with you this case of a patient who had cataract surgery and then underwent Istent Inject W placement. And I'm going to show you how I'm able to position the chair and the microscope in order to maximize the angle of approach. And you're going to be able to see how the two eye stents are placed really quite far away. And this really is very important because you want to maximize the angle to be able to hit as many collector channels as possible, which will maximize the IOP reducing effects of the Istent Inject W. As you can see, this patient's already had cataract surgery, and I'm injecting some cohesive viscoelastic into the anterior chamber and then on the cornea. I've turned the microscope away from me, and now I'm placing the gonio lens on the eye. I have the sleeve pushed down when I went into the eye. I'm going to retract the sleeve of the Istent Inject W. I'm going to place the trocar into TM, making sure I'm en face as well as not having the trocar being turned side to side or up and down, which can reduce the efficiency and effectiveness of the deployment of the eye stent. I go ahead and push the sleeve back down, come out, and I'm pushing some more viscoelastic to ensure that the eye stent is in proper position. I'm going to rotate the microscope, rotating it clockwise about, I don't know, a clock hour or two clockwise, and then making sure I reposition the gonio lens as well as my chair. I'm going in with the device. The sleeve is down. I retract the sleeve. And look at how I'm able to place this eye stent much more to the right with this because I was able to move the chair in the microscope. So again, I'm going to try to place the trocar. I'm going to stab the TM, making sure I'm not making any lateral tension with the trocar. I deploy the device and then I go straight back out. I'm going to place some more viscoelastic to confirm that the device is deployed properly, and thankfully it is. You can see the heme came out, which again is a little bit of a confirmatory sign that it's in place. And so just take a look how far apart these two eye stents are. They're really far apart. And again, it's because I'm able to rotate the chair and rotate the microscope and be willing to rotate my hand in such a way that I'm really approaching to as far right as possible with that second device. So by doing these extra steps, you're able to get a really wide separation of both eye stents, and as a result, have a higher chance of hitting different collector channels, which again should also maximize the IOP reduction with the Istent Inject W. So as you can see here now, I'm going to remove all the viscoelastic from within the bag in the anterior chamber. I'm also sweeping under the capsule edge, moving all the viscoelastic. You can see there's quite a bit of blanching in the nasal conjunctiva. And so that's covering about, 90 to 100 degrees of the angle there nasally. There's quite a bit of blanching, which means that we've been able to hit quite a bit of collector channels by separating the eye stent in the way we did. So by placing the Istent Inject W far apart, you can see here I'm able to hit about 3 to 4 clock hours of blanching of the conjunctiva here while we're irrigating the eye with BSS. So I hope this was helpful to you, and I thank you for your attention.